This is the Italian region with the best healthcare system. And this is the one with the worst. And in a moment, you'll find out which ones they are. Every year, Italy's Ministry of Health releases a report assessing the quality of healthcare across the country. The goal is to measure the efficiency and fairness of the system, from north to south. The results are based on three main areas of evaluation, corresponding to the country's main types of healthcare services. The first is prevention. All the actions aimed at avoiding the onset of diseases, health checkups, vaccinations, workplace safety, and public health protection. The second service is district healthcare, which includes community-based services provided by general practitioners, pediatricians, home care, and assistance for the elderly or people with disabilities. Finally, hospital care, which includes all the services provided in hospitals, from admissions to surgeries, from emergency room to overall hospital quality. Each area is given a score, which combines into an overall index of regional healthcare quality, with a maximum of 300 points. Let's start with three regions with the best healthcare systems, the ones that achieved the highest overall scores in the three areas. In third place is Emilia-Romagna in northern Italy, with a total score of 278 out of 300. Despite the excellent result, this year the region lost its historic first place in Italy's national healthcare ranking. The drop is mainly due to district healthcare, meaning all the services offered outside hospitals, such as general practitioners, pediatricians, and home care, which help people receive treatment in their communities and reduce the needs for hospitalization. Still, the overall level of quality remains very high. Emilia continues to rank first in terms of patient inflow, as many people from other regions choose it for specialized care, hospital treatments, and advanced medical services. Which two regions do you think overtook Emilia-Romagna? In second place for healthcare quality is Tuscany, in central Italy, with an overall score of 286 points. The region, the most popular among foreign home buyers, remains one of Italy's top healthcare performers, showing significant improvement in hospital care. Three Tuscan hospitals are among the top 20 in Italy: Pisa, Siena, and Florence's Careggi Hospital. Tuscany also stands out for prevention. Excellent results in child vaccinations, cancer screenings, and healthy lifestyle promotion, ranking among Italy's best for public health indicators. In 2024, life expectancy at birth in Tuscany reached 84 years, above the national average, reflecting the region's strong healthcare management. Yet, despite these great results, it didn't manage to reach the top spot, which goes to an even more efficient region. In first place for healthcare quality is Veneto, in northern Italy, with a total score of 288 points. This region, one of the richest and most organized in the country, has had one of Italy's most solid and reliable healthcare systems for over 20 years, particularly strong in two key areas. First, the balance between hospitals and local clinics. Its network of general practitioners, local health districts, and home care services is among the most developed in Italy, ensuring timely and accessible care outside hospitals, reducing pressure on emergency rooms. The second strength is the reduction of waiting times for exams, visits, and surgeries, one of the biggest national issues. Veneto addressed this with targeted strategies, special task forces, extended service hours, and catching up on postponed procedures. The results are clear. In the last 2 years, waiting time for diagnostic exams dropped by over 30% compared to the previous year. Across Italy, Veneto is often cited as an example of good governance, not only in healthcare, but in overall regional management. No surprise, then, that its residents enjoy one of the highest quality of life levels in the country. To recap, The top three are Veneto, Tuscany, and Emilia-Romagna. And now for the tougher part, the three regions at the bottom of the ranking. In third place among those struggling the most with healthcare, we find Sicily, with a total score of 173 points. According to the report, the local healthcare system has been in a state of ongoing emergency for years. The main shortcomings concern both fairness, the ability for all citizens to access the same level of care, and efficiency, meaning the ability to provide timely, quality services. In 2024, the region had 3.45 hospital beds per 1,000 inhabitants, below the national average and far from European standards. Other indicators aren't encouraging either. Sicily has fewer nurses and healthcare staff relative to its population, spends less on health, offers fewer beds, and has longer waiting times compared to the national average. As a result, thousands of Sicilian citizens seek treatment in other regions, mainly Lombardy, Emilia-Romagna, and Veneto, placing Sicily among Italy's top regions for outbound healthcare travel. There are also strong territorial disparities between urban and rural or mountain areas. Mainly inland towns lack adequate healthcare facilities, forcing residents to travel long distances for treatment. These issues have been highlighted by local doctors' associations, describing the system as fragile and overburdened, sustained by the dedication of staff, but weakened by years of underfunding, inefficiency, and the loss of professionals to better organized regions. Hopefully, this beautiful region will be able to reverse the trend and finally ensure quality care for all citizens, reducing the need for medical travel. In second to last place, somewhat surprisingly, is Valle d'Aosta in northern Italy, with a total score of 162 points. How is it possible that a region with such an excellent quality of life, one of the wealthiest in Italy by per capita income, and long regarded as orderly and well-governed, ranks so low in terms of healthcare quality? The negative data mainly depend on two factors. First, a shortage of medical, nursing, and technical staff, a problem common to small or sparsely populated regions like Molise and Basilicata. Less staff inevitably means fewer visits, exams, and surgeries, even if demand remains high. Since 2019, Valle d'Aosta has seen a 27% drop in the total number of public healthcare services provided, compared to a national average decline of 8%. The second factor is the presence of only one main hospital, in Aosta. Many residents of surrounding valleys or mountain towns have to travel long, winding roads to reach the nearest emergency room, with travel times above the national average. Almost half of residents can't reach an emergency room in under 30 minutes, and ambulance response times are longer too, about 24 minutes versus the 19-minute national average. These factors have significantly lowered Valle d'Aosta's ranking in the evaluation of public healthcare quality, despite the region's high economic and social well-being. And speaking of well-being, the region with the weakest healthcare system is unfortunately Calabria, in southern Italy, which scored a total of 150 points. In March, the Italian government even declared a state of healthcare emergency, at the request of the regional president, to speed up the construction of new hospitals and improve existing infrastructure. Calabria's healthcare system has long struggled due to weak local services and outdated, undersized hospitals. As far back as 2009, the region's financial and organizational collapse was so severe that the national government had to step in place the healthcare system under direct administration. The recent declaration of a state of emergency confirms that, unfortunately, those problems still haven't been solved. These issues directly impact the quality of care, Access is slow and difficult, resources are limited, and staff often work under precarious conditions. It's no surprise, then, that more than a quarter of residents seek medical care outside the region, making Calabria the third Italian region for outbound healthcare migration, after Molise and Basilicata. It's a shame that such a beautiful region, rich in history, culture, and landscapes, faces such severe issues in its healthcare sector. It will take real investment, stable management, and better support for medical and nursing staff to restore trust and ensure a fundamental right, the right to health. Here is the full ranking of all Italian regions and their scores. The autonomous province of Trento shares third place with Emilia-Romagna, while fifth place is shared by Umbria and Lombardy. Among the top 10, 6 are in the northern Italy, 3 in central Italy, and only 1 in the south, Puglia. These numbers confirm the clear divide between north and south in healthcare. Northern and central regions provide better hospital care, more efficient local services, and stronger prevention programs, attracting patients from other regions as well. In contrast, southern regions face greater challenges due to older infrastructure, staff shortages, and longer waiting times, which often force residents to travel for specialized care. The good news is that overall, Italy can still count on high-quality public healthcare system, appreciated internationally. In 2023, the 𝗦𝗨𝗣𝗣𝗢𝗥𝗧 Index ranked Italian healthcare among the top 20 in the world, ahead of countries like the United States and the United Kingdom. If you're interested in buying property in Italy, check the video description for 2 key videos. The first explains the entire buying process in simple terms, and the second covers the 7 most common mistakes to avoid and how to protect yourself from scams. If you enjoy my guides and want to support my work, subscribe to the channel with notifications turned on. Ciao!